Hey, everybody. Thanks for joining us on the Merge Medical Podcast. As always, I'm your host, Dr. Jeff Brown, with my co-host, Dr. Jeff Cole. We are very excited with the guest we have today. This is Dr. Shawn Baker. He is a multi-sport record holder, an author of the Carnivore Diet, entrepreneur, just advocate of great health, starting some clinics called Revere. He's been a guest on the Joe Rogan show. That's how I came to be introduced to him. And I really think he's part of a great awakening that's taken place in America regarding our nutrition. And we're just super glad to have you here, Shawn. I got to tell you, man, I am a big fan. Jeff Cole, once he started learning about you, you're bucking the industry, and you're really, really part of an awakening in so many ways. And I hope you are beginning to understand how important people like you are to the world, because you're waking us up. And I thank you for being here.
Yeah, well, I mean, I appreciate it, guys. And I just, I was just kind of looking at, we saw the CEO of United Healthcare just got popped, got murdered the other day. I mean, and it's tragic. I was just commenting on that. It's truly tragic, but it really is a symptom of a disease healthcare system that we have. I mean, it really is. And I mean, you can point it down to some disgruntled person that got pissed off because maybe their family got denied a claim. Maybe that's what we don't know. They ain't caught the guy yet. But even if that is that, I think about it, it's like, how much money are we spending on healthcare unnecessarily? And, as a physician, I remember sitting on the phone with healthcare companies trying to get an MRI approved or something. And it was just frustrating. It's like, why the hell are we, because it costs so damn much. We spend so much money in this country. The results are not that good. I mean, clearly we're lagging behind in every indicator, chronic disease prevalence, disease rates, life expectancy now. And so it's like we spend too much damn money. And the solution isn't more technology, more money, more funding, more efficiency of delivering the same crappy healthcare that we are. The real answer is, let's stop having so many damn sick people. And that starts with fixing the nutrition, changing the way people eat, changing the way we're incentivized as healthcare providers to, and giving us the tools. This is a thing. I practiced for many years as an orthopedic surgeon, where I was good at it. I mean, my job, and I was very efficient. My job is to get people to the OR, cut them up, stitch them up, and get them on their way. But had I wanted to say, hey, no, let's fix your diet, let's fix your lifestyle, let's help you in that, I had no resources. I mean, there was nothing. The best I could do was go read this book, go watch this video. That's not good healthcare. I mean, there's a lot that goes into it, and that's what I'm discovering. And I think that, and even the lot that we're able to put into it through our company, way cheaper. It's way cheaper than all the other, kind of high tech, super miraculous stuff we're led to believe. Anyway, that's an introduction.
No, that's great. That's exactly where I want the conversation to go. And I thought, after I started following you, I thought, how much nutrition information did I learn in medical school? Like, I learned how the body breaks down everything, puts it back together, but how much dietary? I mean, I don't remember getting any.
You learn about pellagra and beriberi and, friggin' scurvy and rickets and all, basic vitamin deficiencies a little bit, but yeah, you're right. I mean, it's not part of their toolbox. I mean, it's just not part of our toolkit. We're learning how to differentiate, do a differential diagnosis, how to diagnose and then treat. And our treatment options are almost invariably, there's lip service given the lifestyle, but it's all it really is. It's lip service with no teeth behind it. And then it's drugs and procedures and more tests. And yeah, so we're not designed for that. We're not the best. I mean, I tell people, don't go to a doctor if you want to learn about nutrition. They don't know. I mean, you get just good advice from your plumber in many cases, depending on what they've read,
Well, how many of us have gone to the doctor with any ailment and the doctor say, well, what's your diet?
It never happens. It doesn't happen.
It never happens. But when the fish are sick, you clean out the fish tank, right?
Yeah.
Isn't that the analogy?
Yeah, that's the analogy. Yeah, the fish are swimming in polluted water. Let's move them to a different tank. But I mean, it's like, if you're chronically poisoning yourself with your environment, with your food, with some of the other things that go into that, you're not going to. I mean, like I use an analogy. If somebody walks in your office and says, "Doc, I've been hitting myself in the head with a hammer every day, and I got a headache," and you say, well, here's some aspirin. I mean, that's effectively what we're doing. We're like, hey, just take the hammer out of here. Stop hitting yourself in the head.
Right.
We've always heard you are what you eat, but we don't live that life in any
Well,
sort.
yeah, I mean, it's, it goes to nutrition. You think about what do we know unequivocally, that's the clear scientific facts about nutrition and what we need as a human being, as a species. Why do we eat in the first place? Well, we want essential amino acids, we want essential fats, we want some form of energy, we want vitamins, minerals, and water. That's it. That's the only reason we need to eat as a species. And, we can talk about what's the most effective way to do that. But I mean, why many of us eat, because we're bored, because we're constantly hungry, because we're propagandized to or marketed to, because we're addicted in many cases. I think that in many cases, treating chronic disease, you have to address some component of food addiction for many people. I mean, that's really the problem. It's like, how do you get people to stop eating garbage, which is clearly killing? And this is, I mean, we've known this stuff for 50 years. It's just that we've never, we tell people to go on a low fat, cardboard rich diet, expect them to succeed. And when they fail, we say, oh, diet doesn't work. Here, take your damn, whatever drug it is.
My parents, so I'm a physician, obviously, and my parents think they're doing themselves a favor if they are eating a baked potato with no butter. And it doesn't matter.
It sounds like torture, man.
Well, I know it is, but I want to get into this way into the weeds. Somewhere it broke down, right? Like I did a little bit of research before you came on, and all this. I don't know if Jeff Cole knows this, but so everybody listening, Philip Morris, which is Altria, this is a big cigarette manufacturer, right? In the 80s, the gig's up, can't do cigarettes anymore. Okay, everybody knows it's addictive, causes cancer. So what did they do? They started buying food manufacturers, and I mean processed food, right? Yeah. Philip Morris bought General Foods, maker Kool-Aid, and 1,000 different other products in 1985. R.J. Reynolds followed with the purchase of Nabisco, which makes Hawaiian Punch, then Kraft, etc., all this stuff. And if y'all remember, we're all around the same age. They introduced fat-free stuff about the same time. And there's a whole generation of people that are stuck in the mindset that fat is bad. And I remember in med school, and I don't want to get too deep into this because it'll show how much I've forgotten, but what do you got to store fat? You got a glycerol and 3 fatty acids. And I thought, wait a second. If you're going to store fat, it's got to start with carbohydrate, the glycerol, sugar, backbone structure. You got to have carbs to store fat because that's how it's made, right? Am I saying that right? All of it didn't make sense. And I put 2 and 2 together. I said, wait a second. Type 2 diabetes is a disease of obesity. If you lose weight because the fat is insulin resistant, the type 2 diabetes goes away. But we're telling all these people that sugar's okay because what did we do with the fat-free stuff? We replaced it with sugar. And I know that's a lot to unpack, but I think that's a lot about what you're about and what this whole movement is about, is that we've been lied to for maybe a couple generations now about what we should be eating. And the food pyramid, Jeff Cole, that me and you were taught probably should be almost upside down, right?
Yeah, I mean, there's like I said, this is obviously a very complicated topic, and I think in general, many people thought they were doing the right thing, including most physicians.
Right.
I do think there were probably some bad actors that legitimately knew that this was wrong, and they were wanting to profit off of it. Because you think about, our food supply now and how it has evolved or arguably devolved into what it is. Now that you go to the store and get a bright blue Captain Crunch flavored artificial maple syrup, it's like, that's not even food. I mean, who would argue that? And yet you've got dietitians that are funded by these same companies, PepsiCo and Coca-Cola funding these dietitians, telling people there's no bad foods. You everything in moderation. I would say, it's just like saying, should I smoke in moderation? Should I mean, it just doesn't make sense to me. With regard to, as I'm wearing a shirt, eat beef, be happy, right? I'm a big advocate of particularly beef. I think it's a wonderful health food. And the interesting thing is it provides a tremendous amount of satiety. I mean, you sit down and eat a big old steak and eggs for breakfast, and you may not want lunch. You might not even want dinner. It provides that long level lasting of satiety. And, we're living this age now where all these new incretin hormone, mimetics, GLP-1 receptor agonists and the GIP agonists that are out there, that are people taking for weight loss because it has this hormonal impact. Beef itself has a tremendously powerful effect on GLP-1, from the L cells in the ileum. it's short-lived. I mean, as it's supposed to be. I mean, it's a naturally occurring substance. It's supposed to be stimulated in a physiologic appropriate way when we do that. And that's why so many people find that, they eat this stuff and they're pretty full. They're like, oh, I don't want that extra food, or I don't feel like I need to eat all this junk food and garbage. And so we vilified red meat in particular, but meat in general. I mean, it's gotten a bad rap across the board, particularly with the rise of the kind of the plant-based narrative, which up to a certain point, it was, a few kind of skinny vegetarians and a few wacko vegans, 1% of the population. And then the corporate sort of investors, the venture capitalists out of Silicon Valley said, hey, we might be able to make a lot of money on this stuff. Let's really push this message. And they started pushing it really hard. They started dumping hundreds of millions of dollars in venture capital. And then all the obviously the media that goes with that. Largely, fortunately, I think most people have now come to reject that. As you mentioned, there has been an awakening. I think, just to refer to the last few years around the COVID misadventures, the pandemic, a lot of people would argue was the response was pretty, kind of at best incompetent. And some people would say it was evil in some ways, but depending on how far you said. But I mean, irrespective of what your beliefs are on that, there is no doubt that many, many people have lost faith and confidence in these so-called trusted organizations, whether it's the FDA, the CDC, their own doctors, healthcare systems. And I think there's a valid concern around that. And as physicians, in part we're to blame. I mean, we've kind of allowed that to happen. And I think a lot of physicians have, and I was kind of a cheerleader for this. I almost embarrassed to admit that, but when I came out of the military and joined a medical practice, and then I was ahead of that practice, it was an employed position. I was ahead of a big surgical group, and I was convincing docs, hey, come join this. You will let us take care of all the details. They'll do all the billing for you. They'll handle all the hiring and the firing. All you got to do is practice medicine. Take your paycheck. Good deal. The problem with that is you get sucked into that and you lose your independence. You lose your ability to question things. I mean, now it's like, these big health, what is it, Kaiser in California and Intermountain Health through the Rocky Mountain regions. I'm sure there's something running through Tennessee where they've got these giant corporations that have taken over medicine. They swallow up and they gobble up all these smaller practices. And then all of a sudden we got something 80% of physicians now are falling part of this corporate employment structure.
Right.
And you can't, it's hard to change that system. It's hard because we've got, 10-to-1 administrators versus physicians. You guys seen the graphs. Doctors like this, administrators up 1,000% increase. And, we went from the art of medicine, and maybe you guys remember long enough. I don't remember when this term came in, but I remember this concept of disease management. When I started medicine in the 80s, I don't remember that term. I remember at some point hearing about disease management. What does that mean? Oh, you mean I'm not going to cure disease or get people healthy? All I'm going to do is manage their symptoms with a series of drugs. So that's what disease management is. So that's the model we're working under right now, which I think is a great disservice to not only the patients, but the physicians themselves. I mean, you're not happy when all your patients are just constantly sick and all you can do is, here's another pill, here's another drug. That's no way to practice, in my view.
Well, we've got to flip the script because right now it's sick care, and we've got to find a way to monetize preventing disease and keeping people healthy, because right now we'll all agree it's a business. We don't like it. It's sick care business. That's how it works, right?
Oh, absolutely.
Pendulum swinging back. I mean, I think there's an awareness of the price of losing your autonomy. At least I hope that pendulum is swinging back.
Yeah, I mean, it's on the physicians. I mean, you look at, here. I made a little poll on Twitter or X. I said, hey, you know what? If your routine care, your routine primary care physician could be replaced with AI cheaper, would you go to that? Guess what percentage of the patients said yes? 80% said yes, I'd do that.
Wow.
That should be a wake up call. That should scare the shit out of physicians, because if you could, because if all they're using you there is to get a drug refill, and they gotta put their clothes on and drive across town and wait in line and maybe have a lecture or two, and they're like, hey, all I want's a drug. Just give me a damn a little robot do that for me for a tenth of the price, and so on and so forth. So you're gonna make yourselves redundant if you keep persisting in this pill for every ill model, and then until you insist on the humanization of medicine and really start getting at the root cause. And you can't do it in a 15-minute visit. The corporate medicine model is, 30 minutes for a new patient, 15 minutes for a follow-up. As an orthopedic surgeon, I was looking at 5 minutes, man. They were double, triple booking me all day long. I've seen 50, 60 patients a day. in an 8-hour day. And it's like, man, what can you do with that?
Right.
So we've got to take it back, and we've got to say, slow it down. Let's actually doctor patients. Let's heal patients. Let's teach patients rather than just reflexively writing prescriptions based on an algorithm that's been provided to us by a pharmaceutical executive, passed down through our various, advocacy bodies, American Diabetes Association, American Heart Association, the College of Physicians and Surgeons, on and on and on, those types of things. So we have to do that. We have to take it back.
Fortunately, some of the larger companies that have had their entry into healthcare found out that healthcare is hard.
Sure it is.
Walgreens has exited, Walmart's exited. I think there's more meaningful ways that they could get involved in healthcare that would be better for the patients, and hopefully
Well, I just think there has to be a paradigm shift. I mean, you can't just practice business as usual. I mean, gosh, if I'm in a car wreck and my femur's sticking out, yeah, take me to the ER. Don't feed me a diet. I mean, that's not but I mean, for much of it, the reason I went into orthopedics is I didn't want to deal with all the primary care bullshit. I don't want to listen to some person, constantly failing and taking pills and not being compliant and never losing weight and never. That was the impression I got as I remember as a medical student, listening to these doctors complaining about their patients, and I was like, well, I'm gonna go to orthopedics. Some guy breaks his leg, I'll stick a metal rod in, stitch him up, and he's good to go. I ain't got to deal with that stuff. And that was 10%, 20% of my practice. But the other 80% was still the same old chronic lifestyle related disease, all the arthritis, all the tendinopathy, all the carpal tunnel syndrome, and all that stuff, the back pain, all that stuff was lifestyle related. And, once I started to wake up to that, I was like, there's no escaping this stuff. You've got to, even if you're even if you're the left thumb, trigger finger, specialist, that's all you do. You're still going to run into this lifestyle stuff. So we have to take it on. And I think anybody that does not embrace that and figure out a way to make it financially viable, because like you're right, we don't get reimbursed for that stuff. No one's reimbursing you to spend half an hour talking to your patient about, right. you might be able to bill for the hour a little bit, but I mean, it's not like when I approached, this is kind of funny. When I was the head of orthopedics, I was the busiest surgeon in the hospital, just crushing 600 cases plus a year, by far the busiest surgeon in the entire area. And when I went to the hospital, the administrators that were kind of overseeing us, I said, hey, you know what? I would like to spend, just one afternoon a week, maybe talking some lifestyle stuff. And their response to that was not encouraged. In fact, it was completely discouraging. No, we don't want you to do that. No, we don't have an appetite for that. We kind of hired you to do orthopedics, and we don't want you delving into this lifestyle stuff. So, I mean, that was kind of a wake up call for me. It was frustrating. And I'm kind of a guy I don't like to take no for an answer, and I'm pretty competitive. And so anyway, that's why I'm here where I am today. Because I said, I'm not going to put up with that stuff. So.
Well, you certainly are making it work, because, man, you're on fire. I want to dial it back just a little bit. On your history, I mean, about 15 years ago, I started to adopt not necessarily a ketogenic diet, but just my wife and I said, we're not going to eat anything processed. So just meat, chicken, fish, nuts, vegetables. And I dropped 50 pounds and I felt great. And I pretty much stand by that now. I'm not as strict as I was then. How do you go? And that put me in ketosis, which is I want to talk to you a little bit about that too, because I don't think ketosis is an alternate metabolic state. I think that's how we're supposed to be. But how do you go from that to and how did you go from whatever your diet was before, say, I'm just going to eat, do you just eat beef, or is it chicken? I've seen you eat shrimp on Twitter. Tell us about that.
Yeah. So, I mean, I turned 58 in about a month. And so I was probably early 40s. I've been an athlete my whole life. I always trained hard. Even when I was practicing as a surgeon, I still got to the gym and trained and strong. And I was very, very, very competitive athlete. But I realized that my health was starting to go south in the fact that I was, just developing, diseases of what I thought were just normal aging, joint pain, a little bit of, difficulty sleeping, probably some metabolic disease. So I said, well, I can't allow this to happen. I'm presumably a fairly smart guy. I'm a hardworking athlete. I should know better. So I went on this, sort of a journey of playing with my diet and nutrition. Now, I'd never eaten junk. I wasn't like a junk food eater. I mean, I ate some, but that wasn't my focus. I always ate lots of protein, lots of, fruits and vegetables, more fruits and vegetables, to be honest. But so then I got on this journey where I was like, well, I remember at the time I was 40, I was 42, maybe 42, 43. And I was 285 pounds, and I wasn't fat. I was just a big, solid dude. Like, for instance, right now I'm about 250, right? So, I mean, I was 30 pounds heavier, but stronger. I'd won the Highland Games World Championships. It was throwing.
You're 6'5", so
6'5",
you're a tall guy.
Yeah, I'm a big, tall guy. I've always been a big guy. And so I was about 285, and I said, you know what? I'm done being this big. So I dropped down. In 3 months, I dropped down to 230. I mean, it was low-fat diet, high-fiber diet. I was getting up at 4:00 in the morning, a couple thousand jump ropes in, go to my work, go to my clinic. If I had clinic, I go on my lunch hour. We had a little gym attached to the hospital. I'd run over there, get a workout, come home, put my kids to bed, another couple thousand jump ropes. I did that for about 3 months solid. Lost weight, was lean, and I was so friggin' miserable. Man, I was just like, I can't friggin' do it. I mean, the nurses are like, man, we like the fat Dr. Baker a lot. You're kind of an asshole, dude. I mean, because I was like, I was like, listen, I can't do that. I can't live this way, right? So then this is, like I said, this is like 2012 or something like that. And I was like, maybe earlier than that, maybe 2011. I was like, okay, so now I'm going to do this Paleolithic diet, which was popular at the time.
Yeah.
Did that for a while, got into low carb, started reading some books on nutrition, started to kind of adopt a more low carb approach, a ketogenic approach. And then in like 2015, I discovered these friggin' wacko weirdo people eating just nothing but meat online. I was like, what the hell are these people up to?
Right.
It sounds nuts. I mean, it was like,
it sounds nuts, right?
Nuts. It sounded nuts to me. And I was like, but I was morbidly curious because they were making some pretty significant and what I thought were somewhat kind of unusual or outrageous claims, getting all this health going, MS or resolving or rheumatoid arthritis going away, stuff like that. It was enough to pique my curiosity. And I read, I've asked questions. I read some of the literature that they had provided, and I said, you know what, I'm already kind of bought off onto the low carb thing anyway. Let me try it for a little while. So I would do a day or two here, jumped into it. I had steak and eggs for breakfast. I didn't have the yogurt. I didn't have the piece of fruit. I didn't have the whole grain piece of toast. And I was like, I feel pretty good. My gut was starting to feel good. My gut was like, wow, it's pretty good. I eventually worked up to a month of it. This is back in 2016. So about 8 years ago. And by the end of the month, I was like, damn, I feel like 20 years younger. I mean, literally, because I was 50 at the time. And I put my body through a lot of, professional rugby and Highland Games and powerlifting and track and field and all this stuff I'd done over the years. I got some injuries. Fortunately, no major threatening, but aches and pains, and that would come along, and I'd feel 50. Some days I felt like I was 70. But that went away, and I was like, man, I feel like I'm in my 30s again, and that was really, really impressive to me. And so I did it for a month, and then I kind of said, well, that was a fun experiment. Let me go back to something more reasonable. Let me do something that's not so insane. And literally within 24 hours of adding back in just whole, regular, natural foods that weren't meat, I started to feel those things. My gut started to feel not so good. I felt a little achy. And I was like, you know what? All things being considered, I like to feel better. I'm a guy that likes to move and function and enjoy quality of life. And I sure as hell like steak. I mean, I was like, man, it ain't hard.
Yeah.
Man, I like what I eat. So that was kind of my entry into this kind of weird and bizarre world. And now, 8 years later, God, there are not only hundreds, but hundreds of thousands of people that have now adopted this style of eating, in various forms of strictness. And the results are generally pretty damn good. You don't have to, every time I put up a post and said, hey, they say red meat causes diabetes, I'll get 500 diabetics said, you know what? I went on this diet. Yeah. And my diabetes went away. I'm off all my damn drugs. I'm off of my metformin, my insulin, my SGLT2 inhibitor. I'm off all that crap. And I've lost 50 pounds and I feel great. And it's like, at some point you've got to, there's evidence-based medicine, but there's also results-based medicine. And I think we have to realize that the evidence that we base a lot of our decisions upon is not all that great. In many ways, particularly nutritional evidence. It's hard to do really good, highly controlled, specific experiments on human beings when it comes to nutrition over a long period of time with good clinical outcomes. I mean, we might be able to look at a few biomarkers here and there, but I mean, and I tell people, people are asking me, hey, well, what if this diet makes you live shorter, or you get cancer, or you get heart disease? I'm like, well, I don't know. Maybe that will be the case, but there's no way to predict that based on any studies we're doing. There's no diet where you've got, we don't have a 50-year randomized control trial of twins locked in a metabolic ward eating one diet versus the other with everything else held consistent. We never can do that. So at best, we're like doing these, large scale epidemiologic studies where you ask 50,000 people to fill out a food frequency questionnaire to ask them, what did you eat for the last 6 months? And it's always inaccurate. I mean, it's always bad data. And then we're like, well, maybe there's a generalized trend there. And then we'll get some small signal, maybe a relative risk of 20% increase or decrease in this or that. That's really garbage. That's really garbage data. So I'm like, I don't know. I have no idea if this diet will make me live longer or shorter. But what I do know and what I can see is I can take someone who's profoundly sick and make them profoundly better over a short term. And I think that's incredibly valuable. And so I think if you can use that as a tool, and then you can kind of say, okay, where do you go from there? I mean, do you think the person who has intractable depression where they can't get out of bed and they're suicidal all times cares about heart disease in 30 years?
Right.
That isn't even remotely what they're thinking. I don't think they're going to live a year. So you can take those people and you can get them significantly healthy to where they return to a normal functioning life, and they can, rejoin their family and all this stuff. And I've seen that for almost every condition you can think of. Then they can decide. I mean, because, when it comes to like longitudinal studies, and you say, well, let's do a food frequency questionnaire, knowing that the data is bad, the outcomes are questionable. But, you could say, well, what about diabetes? I mean, that's not well, maybe I forgot I had diabetes. That's a pretty concrete diagnosis. Either you have it or you don't, or or any condition. You can say, well, what happens to diabetics over the long term? Well, yeah, generally the life expectancy is shorter. We know that. I mean, that's not a surprise.
Mm-hmm.
So what happens if you can put your diabetes in remission? What does that do to you? What does that do to your long-term outcome, irrespective of what diet you use, right? I mean, because we have stronger data versus really nebulous, weak sort of, poor data. And this is what, like Washington University in 2022 came out and said, hey, look, all the crappy studies on red meat, I'm paraphrasing here, but they said it's based on shoddy research. All this epidemiologic associational data, John Ioannidis at Stanford, one of the most highly cited scientists in the world, has said, we've literally wasted billions of dollars doing nutritional research, which has taught us basically nothing because it's so poorly designed. I mean, if anything, we need robust, RCTs, really looking at clinical endpoints, and we just don't do that for the most part. So, I mean, I'm hoping, like I said, I'm behind the scenes, for all the monkeying around I do on social media, and I do a lot of it just to get people aware of this and try to grab people's attention. In the background, I'm in there, pushing for studies and talking to funders, funding sources, and researchers, and trying to get this stuff done. And we're finally making progress to where we're going to get some of that stuff out there. I mean, there's been a whole series of case series that have come out now showing that this is happening, at least for some people. I mean, I know some people go on this diet and their IBS goes in, or their IBD rather, their Crohn's disease, ulcerative colitis goes in complete remission. The question I have is that effective for 10% of the population with that disease, or is it effective for 90%? I don't know. We don't know where the relative numbers are. So hopefully we can find something out with some interventional trials.
I couldn't quote the study, but Shawn, you might be able to. I think it was in mice, red meat. Maybe it wasn't in mice. It might have been humans. I'm pretty sure it was in mice. Red meat was the only thing that they've shown that actually lengthened telomeres. Do you remember this?
There was a study out of Poland on it was actually in human peripheral monocytes. I think it was looking at white blood cells, and they looked at telomeres in that population. Yes. And they said that of all there was various foods. I can't remember everything they said, but they said the only thing where telomeres were lengthened were, surprisingly, this was in their conclusion, surprisingly, unpredictably, red meat caused a lengthening of telomeres, which is supposed to be associated with aging, aging or lack of aging, rather.
Lack of aging, yeah. And that's remarkable. And I would be remiss doing this podcast with you if we didn't talk about the lipids, the lipid profile. You had talked on Joe Rogan a little bit about heart disease and how, because you had just finished up a big study. Can you speak a little bit to that?
Absolutely. Yeah. So, I mean, the classic teaching is that, saturated fat drives high cholesterol in turn drives cardiovascular disease. And there is some truth to that. There's no doubt about that. However, I think there's a lot more nuance to this. And, I don't want to be so sort of naive to say that it's, total cholesterol. I mean, there's a lot of subtypes, and people are talking about ApoB and all the various lipopropyl A. And there's all these, various particles that have differential atherogenicity. I think what we're starting to discover is that, why is my cholesterol high is just as valid of a question as to the fact that is it high or not, and so if we say, why is it high? Well, there's kind of two basic scenarios. One is, why do we have cholesterol circulating in the blood? I mean, well, it has multiple, it's part of the immune system. There's reasons for it. But when it comes to energy metabolism, we have lipids, and cholesterol goes with those lipids in the blood because they're packed in, lipoproteins. It's to deliver energy to cells. Cells are utilizing, both glucose and free fatty acids and triglycerides and ketones, and it's part of the energy delivery system. And when we are metabolically compromised, let's say we're pre-diabetic, we're insulin resistant, we're a little bit fat, we got a lot of stored energy on our body, we got too much fat in our cells, we got too much glycogen in our liver, that energy in the blood has a hard time being utilized. So it sits there. It's kind of like sitting, it's like sludge almost in a way. I know this isn't a perfect description of what's going on, but it serves a purpose of what I'm trying to get to. That situation, which probably 90% of Americans find themselves in, the average American right now, blood glucose is pre-diabetic. The average American blood glucose is, or, A1C rather, I should say, is something like 5.758, which is, basically pre-diabetic. That's a scary statistic. And so the average American that comes into the doctor's office is going to be some guy who, when they're sick, and they don't go to the doctor if they're healthy. So they're come in there, they're going to be kind of tired, fatigued, middle-aged, maybe got too much belly fat, maybe they're a little mildly pre-hypertensive, maybe they've probably got some insulin resistance. They got too much stored energy on them, high cholesterol in that situation, bad news. The answer is to lower it on a population level. That probably that probably is generally of net benefit for many of those people, although there's some clear problems with statins and some of these drugs. But let's contrast that to a different scenario. So let's say you are now a very lean individual. You don't have a lot of stored energy on your body. Your liver glycogen is pretty depleted. You don't have a bunch of fat stuffed into all your cells. And now your cells still need energy, right? There still needs to be energy. And so your liver is going to do its job. It's going to traffic that energy. And so what happens is the lower your carbohydrates go, glucose becomes less of a available fuel. And so your liver says, I got to feed these cells. So now it's going to pump out more lipid into the system, and concomitantly cholesterol is going to rise with that. So now these hungry cells are saying, feed me. And so that sluggish, stagnant sort of pool of lipids, now you've got this high rapid flux turnover going over there. And so we have two different reasons for the cholesterol being high. And so the question now becomes, are both situations equally as dangerous? And I think the evidence is starting to show that the former, the fat guy with, the sedentary guy with all the metabolic disease, that's probably a problem. But the lean, metabolically healthy person, it's probably not as much of a problem, or may not be a problem at all. It's hard to say. There's a couple studies out there that are looking at that. I mean, one I would point you to is the study that Mortensen done out of Denmark in 2023, I believe, looking at, it was like 50,000 patients in Denmark. And they looked at people that had, whether they had visible cardiovascular disease based on a CAC score, coronary artery score. And those people that had disease, if they had some level of disease, which usually means they probably had some other metabolic issues, then the LDL cholesterol was directly correlated with progression to what's called MACE, major adverse cardiac events, heart attack, stroke, revascularization, sudden death. But if they did not have any existing disease in the heart, then it did not matter what your LDL cholesterol was. It could be 200, it could be 52, no correlation whatsoever. And that's kind of what Budoff and those guys have found in the so-called keto study that was just published in September of this year. They took 100 patients with ridiculously high LDL. We're talking 2, 3, 4, 5, 600 LDL cholesterol. I mean, highest you'd ever see. I mean, ridiculously high. And these people are all on a low-carb ketogenic style diet, and they were all older. I mean, they were all 50, 60, 70 years of age. They weren't young. And they all, but the otherwise were metabolically healthy. They weren't fat. They had pretty good markers when it came to, normal glucose control, normal blood pressure, no significant, triglycerides were low, HDL was relatively high. And they matched that to another group that was exactly the same with one exception. This group had low LDL cholesterol. So they had, one group metabolically healthy, high cholesterol, one group metabolically healthy, low cholesterol. And they did precision CT angiography. Matt Budos, one of the leading guys in the world on this. And what they looked at is they said, well, what's the result? What they found out was that the people with the high cholesterol in this study actually had slightly less cardiovascular disease than the low cholesterol people. And not only that, there was zero correlation between the amount of cholesterol they had in their blood and what was shown on the angiography. Some guys had a little bit of plaque. Nobody had a lot in this group. Some, but it wasn't correlated. The person with the 600 LDL cholesterol had zero. They had none. Where somebody with like a lower version had a little bit more. So that was, phase one of this study, 5 years of, retrospective data. Now they're doing the prospective data on that. They're doing 1 year probably. And then I think they got funded for 3 years. And so that data, I am told, it's not been published yet, but I am told that there are some people within the high cholesterol group, which actually even saw regression of their plaque. And if that's true and gets published and peer reviewed, that's going to be, it's going to be a paradigm shift, or it should be, right?
It will. You make it sound like conceptually, I want to just kind of make it simpler for people that aren't medically inclined that might listen to this. Conceptually, if you're in a state of ketosis where you've got this healthy milieu in your blood, then perhaps the lipids, the fatty acids that we're using for energy, instead of being available for plaque formation, that they're being shuttled into those mitochondria, the powerhouse of the cell, for energy production. Is that, in a big picture sort of way, what you're saying?
You kind of think of that way. Like I said, if you're using the cholesterol in your blood, it needs to be there. If it's just sitting there because it's got nowhere to park, because all the parking blocks are full.
Where's it going to go?
Like you're in Christmas at the mall, and there's no damn parking spaces. It's like, it's going to circulate.
Yeah.
Whereas when everybody's moving, and when it's rush hour and everybody's moving, well, not rush hour, when there's when things are flowing a lot better, it's different. So I think that's not the exact thing that's going on, but conceptually it makes sense. There's two different scenarios. And, my friend Ben Bickman is just about to publish, he just published this. I'm going to talk to him about this on Tuesday.
Mm-hmm.
Like, for instance, uric acid. Uric acid has been associated with, well, number one, gout. We all know that. Number two, high uric acid has been associated with cardiovascular disease, because, and the reason for that is, when uric acid is high, there's a concomitant increase in inflammatory cytokines. There's, IL-6 goes up, tumor factor alpha goes up, and a few others. And what he did a very nice study the other day where he basically took, and this is an in vitro study, so there's some caveats to that, but he took these cells and he bathed them in uric acid and watched them die quicker, and he watched them produce all these inflammatory cytokines. And then what he did is they took that cell and they bathed it in uric acid, and then they added ketone bodies, beta-hydroxybutyrate, to it. And guess what happened?
They got better.
It mitigated all that stuff.
No, I'm familiar with this.
Right.
Sure.
So this study, I have a Twitter Spaces coming out, or an X Spaces on Tuesday with them. We'll talk about that study. So, again, I think we have to realize that, our RDAs are, reference ranges for labs are kind of conditional depending on what your population is,
and based on a traditional American diet, hence the
right. Most of this stuff, most of these RDAs, which were developed in the 1930s, 40s, 50s, whatever, was based on the standard diet at the time, which has been, for the last, probably 10,000 years, basically, quite honestly, on a grain-based diet in which somewhere around 50% your caloric intake is based on carbohydrates. So what happens when you drop that to 0 or 10%? Then we have a different metabolism, quite honestly, and I think we have a different set of requirements. The RDA sort of touches on this in some ways. For instance, the zinc RDA is whatever it is, and I can't remember. Maybe it's I can't remember the number. But anyway, the point is, what they say is if your phytic acid consumption, and where do you get phytic acid? Grains, legumes, things like that. If it's more than 1 gram per day, then your zinc requirement will double. If it's more than 2 grams a day, then your zinc requirement will triple. And the reason for that is because we know it binds to these molecules. The minerals are bound up with the phytic acid, and we can't absorb it. So, I mean, again, we have to realize that, just because there's a study, you got to say, is that study pertain to me? If I do a study on miniature penguins living in the Galapagos Islands
It
and
doesn't
try
apply
to
to you.
transfer it to me, I'm
Yeah.
like, I'm not that. That's not me. I'm
Yeah.
not. The
And
same
that
thing
same
with
sort
human
of
studies. Yeah.
that same concept applies to vitamin C, which I was going to ask you about. Is people when I talk to people about you, they say, "Well, what about scurvy?" And so I did a little bit of research, but tell us about that.
Yeah, I mean, so, we would assume that meat has no vitamin C. That's actually factually incorrect. I mean, it turns out that the USDA never assessed meat for vitamin C. I don't know why not, but there's a small amount. There's something like 10 milligrams per pound or something like that. It's a pretty small amount, but it's enough, some people think, to prevent scurvy. But I mean, the reality is, I don't have scurvy. I mean, scurvy takes place in, generally it's thought to take place within about a month or two. If you go without vitamin C for a month or two, you start developing signs of scurvy. Scurvy's a bad deal. I mean, you die from this stuff. Your joints all bleed, your skin falls apart, your teeth fall out. That ain't happening to me. And I've not ever seen it happen to anybody on this diet. There's been a few people said, oh, I got some irritated gums. I mean, that's probably something else. But so one thing we've known this for close to 150 years. I mean, they had sailors that would go to both the South and the North Pole and exploring, and they knew that in order to prevent scurvy, if they had access to fresh meat, it was not only preventive, but it was also curative for scurvy, because some people would get scurvy. I mean, the so-called limeys, these British sailors that would sail around the world and they would eat lime so they wouldn't get scurvy. The reason for that was that, the meat that they were consuming aboard ships was often preserved and dried. And so, you just have to have access to fresh meat to prevent that.
And that disrupts this vitamin C in it.
Well, and there's more. I mean, there's much more of that. I mean, like vitamin C, if you look at a projection of it, you take an organic chemistry molecule of vitamin C and you compare it to glucose, they are almost identical. I think there's one little hydroxyl molecule. And because of that, they share the same co-transporter. I mean, they competitively compete with each other. So when you are in a glucose-rich environment, then the cells that would absorb that vitamin C it's being competed against. So when the glucose is low, vitamin C flux is higher, and this occurs across epithelial layers in the gut. It occurs across mitochondrial membranes. It occurs across every transporter in the body, and so low glucose increases vitamin C availability. Also, we know that vitamin C is an antioxidant. Well, we also know that when you in a low carb state, your endogenous antioxidant system is often elevated. So we see more glutathione and things like that in our body will elevate due to the low carb state. So then some of the vitamin C's requirement goes down. We also know that red blood cells actually can recycle vitamin C. We have the capacity to do that. So that becomes upregulated. We also know that, one of the roles of vitamin C is obviously in collagen production. And when you're eating a lot of meat, you're actually consuming collagen, you're actually, and we actually have transporters for these hydroxyproline, hydroxylysine. There are, these tripeptide transporters in the gut. So we can actually absorb that intact. But just as importantly, carnitine metabolism is part of the sort of fat oxidation system, and vitamin C is intimately involved in that. However, when we're consuming a lot of carnitine, where do we get carnitine from? Carnitine, carnicin, all these names all come from the root carne, which is meat. So we get that in abundance in red meat. So that again, so what I'm saying is we have better absorption of vitamin C, and the requirement actually goes down when we're not consuming a bunch of carbohydrates or not being bathed in glucose. So again, and there's a number of scenarios like that throughout the nutrition spectrum. And at the end of the day, I mean, it's kind of interesting. I laugh because somebody was saying, well, where do you get calcium from? And that's true. There's not a lot of calcium. I mean, there's some in meat. I mean, how do you guys might remember physiology, your basic, your physiology class, we talked about muscle contraction. Well, muscle contractions are predicated on, calcium release into the sarcoplasmic reticulum and so on and so forth. And so we got to have muscle. We have to have calcium in our muscles, right? It's there. It has to be there if it's required. And so it's in muscle. So if you eat a muscle, guess what's in there? There's going to be some calcium. I mean, it may not be as much as a, big old glass of milk or something like that. But the thought was, well, because calcium, it doesn't meet the RDA. Therefore, I remember these people were telling me, well, then we must have been eating like eggshells and bones. this was the explanation for that. I'm like, that's ludicrous. I mean,
Yeah.
would you eat a bunch of eggshells?
Who's
and
eating
bones?
eggshells? You know,
No, no one would do that.
Nobody's
So I'm
eating
like,
eggshells.
but then I'm like, well, where's all the calcium deficiencies? I've never seen anybody with low blood calcium. And you can say, well, it's because you're cannibalizing all your bone, because that's where our calcium stores are. But again, we're not seeing that. I'm seeing the reversal and improvements in things like Z-scores on DEXA scans. I mean, I'm
Really?
seeing, I've seen, or T-scores. I've seen people actually remineralize their bone, where they go from, -4, which is like your bones are going to fall apart if you sneeze hard, to starting to get back to more normal levels.
So this is reversing osteoporosis.
Oh, yeah, absolutely. Reversing osteoporosis. Now, I mean, it's, you should do that in combination with weight bearing exercise. But I've talked to a number of women who've had sequential, DEXA scans, and it's shown that conclusively. Pretty interesting.
So I know you eat ribeye. I see you eating ribeye all the time, and I love ribeye.
I have one today.
Tell me in a week what you eat, or in a month besides ribeyes. What else do you eat?
I eat a lot of fatty meat because, quite honestly, I got to have energy. I work out pretty hard, so I have to have energy. So fat's my energy. I don't have a lot of carbohydrates. I have effectively zero carbohydrates. I will eat a lot of red meat. I will eat some fish from time to time. Like you said, I'll have some shrimp. I'll have some eggs, here and there. I'll have a little bit of dairy from time to time. And that's pretty much the diet. I mean, that's probably my diet 99% of the time. Every once in a while, and I'm not religious about it. I'm not like this is a religion. I'm not here to save the tomatoes or anything like that. It's not my deal. I do it because it's what I feel best on. I enjoy the food. I mean, I'll tell you what, every time I sit down to a ribeye steak, I enjoy it. And and I've probably eaten 10,000 of them, the last couple of years. I mean, I'm not exactly, if I had to really estimate it, I've been doing 8 years, probably eat between 3 to 4 pounds of red meat every day for 8 years, steaks, mostly in the form of steaks. I've probably eaten close to 10,000 steaks.
That's amazing.
Just with any food program, you have to have a plan, and you have to plan for the plan. Like, what does your day look like? How do you actually get this done? Do you cook the steaks at home? You're saving.
Yeah, I mean, I generally eat most of my meals at home. I eat most of my meals at home. I usually eat about twice a day. I mean, that's just what I feel like. I feel like I have enough hunger for. I prefer to eat earlier in the day rather than late. Just 'cause I feel like I sleep better when I don't have a big bolus of protein sitting in my belly that I got to metabolize overnight. So I tend to sleep better. What I do, I've been doing this for 8 years. So it's a little bit different than what I would tell somebody who's new to this. Somebody that's new to this, they'll always ask me, what should I eat? How much should I eat? How much fat should I eat? How much protein should I eat? And I think there's answers to all that. But I think the real answer for most people is you eat enough steak or ground beef or eggs or bacon and eggs or whatever it is, so that you don't want to eat a cupcake. Right? I mean, that's as simple as that. Just eat enough so you don't want the bullshit. Right? I mean, that alone is, I think, very good advice. And you do that for a while until you get to a point where you're like, I don't need that stuff. I can be hungry. And I was a guy, I love dessert, man. I love cakes and cookies and ice creams. I love that stuff, man. I still do. To this day, I love it. I just don't need to eat it. I don't feel like eating it anymore, which is really a blessing, because if I were to eat that stuff ad lib, I'd probably be dead already, or 400 pounds or something like that. So, I mean, the thing is, you eat enough good nutrition, you actually provide your body nourishment to the point where you just don't feel like that other stuff. And this is why the snack food industry doesn't want us to talk about this stuff.
Right.
It cuts into their bottom line quite amazing.
Yeah.
I tell people, it's like anything you want to eat that's on the animal spectrum. If you like pork, if you like fish, if you like, shellfish, if you like chicken, if you like beef, if you like lamb, if you like, lobster, if you like squid, if you like, octopus, whatever, quail, I don't know, whatever you eat, deer, bison, go for it. Have that. Eggs, dairy products, kind of a gray area. Some people do fine with it. Some others, I tell people, use it as a condiment initially. And then I tell people, hey, if you need some seasonings and spices just to get through, I couldn't tell somebody, hey, you're going to eat plain ground beef for the rest of your life every day. No one's going to do that. And no, I wouldn't do that. Right. So I tell people, have fun with it and enjoy your food. I mean, there's no one succeeds on a diet when they don't enjoy the food or they're hungry all the time. So you got to deal with those things. So eat to satiety, eat when you're hungry. Not hungry, don't eat. And this is what a lot of people will find, that they're like, you know what? I had steak and eggs for breakfast and I'm not hungry the rest of the day. And I'm like, well, if you got good energy, you don't need to eat. Good. Use your own body fat. That's fine. There's nothing wrong with that. A lot of people do undereat. This is the one problem I run into. A lot of people go into it with a preconception. I'm going to go carnivore and I'm going to lose 50 pounds. And so I'm going to intentionally restrict how much I eat, because that's what you do. When you lose weight, you got to restrict your calories. And I mean, here's an interesting concept. There's this thing called the energocentric model of satiety, or something like that. So this is what it says. So let's say I go on a diet. I'm going to cut 500 calories out of my diet every day, right? Let's say I have an established baseline. We know what it is. I'm going to go on a 500 calorie deficit. And at the end of the week, I will accumulate a deficit of 3,500 calories. I should therefore have lost 1 pound of fat, right?
Right.
That often doesn't happen. And part of the reason for that is a lot of times people start feeling hungry. So what happens when you're hungry? What does that mean? Well, it means that your body has been unable to provide you the sufficient energy from its own resources to keep you satiated, right? Or keep you in satiety, in a state of satiety. So that means you're not burning that 500 calories that you're not eating. You're maybe burning 200. So now you're like struggling with hunger all the time. And so weight loss should be something that comes without significant hunger. I mean, that's when you're truly utilizing those resources. And some people will notice that when they do a prolonged fast. They'll be like, you know what? I didn't eat anything for 3 days or 4 days, and I wasn't that hungry. Why is that? Because your body was providing its supplies to you so that you kind of maintain that energy flux. Yeah, but I mean, as far as setting up the diet, I mean, it's very simple. The nice thing, I mean, there are no animals on the planet walking around with a Fitbit and an app telling them how much to eat and when to eat and how many molecules of protein and how much vitamin C they're supposed to eat. There's nobody does that. I mean, my dog doesn't need a friggin' diet plan. I mean, I throw some meat down for the dogs, they gobble it down, they're good. I mean, and really, I think humans should be the same way. We shouldn't expect where we've got some fancy requirement for nutrition. It should be pretty straightforward. So a diet that can provide you nutrition, satiety, without turning you into a big fat ass, should be a pretty good diet. And that's what these diets tend to do. I mean,
Right.
I've seen it for time and time again.
And I want to clear a couple of misconceptions when I talk about you. You don't tell people to not eat vegetables. You're just saying this works for you. We're seeing numerous benefits from this. Yeah. Anecdotally, and they're piling up. So you're not against vegetables. You're just saying, hey, this works for me. But you are against like us processed junk.
Yeah, I mean, some of that stuff shouldn't even be called food. I mean, that's clearly. I mean, like I said, when you get in there with the blue Captain Crunch flavored artificial maple syrup, that's not food. No one should be eating. That should not even be on anybody's menu. Vegetables, and there are people out there like my friend Anthony Chafe. He's like, vegetables are trying to kill you, right? Plants are trying to kill you. And I mean, there is some truth to that. Yes, plants have toxins. Yes, they're designed to prevent ants from eating them and caterpillars and things like that. And those things are there. I mean, humans, I mean, my retort to that is, well, if they're trying to kill us, why are there 8 billion of us on the planet and most of us eat plants? I mean, so they're not doing a very good job of killing us. Now, there are certainly people for which the removal of even healthy vegetables is actually a net benefit to their health. And I see that all the time. I've seen people that were literally rheumatoid arthritis, eating a really clean, healthy diet, no processed food, no sugar, no refined grains, meats, vegetables, maybe some nuts and things like that. And you say, hey, let's just go just meat only for a while. And lo and behold, their damn arthritis gets better. So, I mean, there's something to that. I think that, I mean, I don't personally like vegetables. So I'm I mean, I'm biased in that way. I never liked them as a kid. I don't like them as an adult. I kind of choked them down for a number of years because I thought they were the things I was supposed to do. But I can remember eating these big old spinach salads. And I was like, the only part about this damn spinach salad I like was the bacon and eggs and the olive oil dressing. The spinach itself was garbage. It was awful to eat. You eat a plain bowl of spinach with nothing on it. It's like, oh man, who wants that? So, I think, as I said many, many times, there's a number of ways to get healthy. This isn't the only way. But for many people, particularly people that struggle with certain autoimmune conditions, food addicts, for instance, these people sometimes need the rigid level of abstinence that's required. I had a gal, she was literally 800 pounds. She had done everything. I mean, vegan diet, juice diet. She had gastric banding. I mean, years and years and years, she just could not she could not stop herself from eating all the garbage, the cookies, the cakes, the candies. She went on a carnivore diet, and within 2 years, she lost 500 pounds.
My
And
God.
she said, I found the off switch. For the first time in my life, I found the off switch. I mean, I've interviewed her. It's amazing. I met her in person. Another guy, Todd, same sort of situation. 700. I was interviewing this dude. He's a good old country boy from Wyoming, and he was talking to me. Maybe Montana. I think it was Wyoming though. He was talking to me, and we're just doing a conversation like, "Hey, how you doing?" Blah blah. Tell me your story. And he was telling me, when I was 14, I was 600 pounds. And I was like, "What? 600 pounds at 14?" I was like, "Where the hell did that come from? I just never heard of that before." And he's like, "Yeah, we were working out in the fields, and I was having a hard time because I was 600 friggin' pounds at 14 years of age. His parents were all fat. His mother and his sister had a gastric bypass. They tried to get him to do that. He was 40. I mean, he told me that, he got up to like 775, sitting in his chair, because that's all he could do. Sitting in his big old lazy boy chair, had a little, porta potty next to him, a little mini fridge. And he sat there and he said, "You know what? I did a fast for 40 days. And I really just basically didn't get out of my chair for 40 days. I mean, that's like living in hell. I mean, just 40 days, so fat, you can't hardly move and nothing. You just sit there and do nothing." He went on carnivore and now he's lost, I think, 300 pounds within like a year and a half. And so, I mean, from the sort of eating disorder standpoint, it's been incredibly powerful. In fact, on the other side of the spectrum, I've talked to a number of women with, severe anorexia nervosa, which, if you guys don't know, it has a very high mortality rate.
Mm-hmm.
A lot of these anorexic women just die. They just die. The failure rate from traditional treatment is horrible.
Yeah.
I talk to these women, they get sent in for inpatient, and what they do in the inpatients is they literally force feed them cookies and cake and garbage and tell them there's no bad food. You can't leave this room until you eat that cookie, right? Trying to bargain with them to teach them to not restrict, but they feed them junk food, and it's like that's not the way you treat an illness. These women, they go carnivore. And there's a case series written up by my friend Nick Norowitz and Michelle Hearn. It was published earlier this year, maybe end of last year. Same thing, full remission. I had a woman she was like 65 pounds. On the verge of death. She was inpatient. Reached out to me, was just telling me all the crazy stuff they were doing to her. I had all these co-infections and all this stuff going on. And she did that. And now she's like 130. She's jacked, muscular, has had a kid. It's changed her life. So, there are, there are some just incredible, amazing things would happen when you actually provide high quality nutrition to human beings that are sick. It's just inspiring and crazy stuff I've seen.
I'm surprised because with that, I would have thought that that's more of a body image thing, but yet changing what they ate fixed it.
Obviously it is. They've got this body dysmorphia but it's a mental illness. You think about it. Yeah. When your brain is not being nourished correctly, well, shit doesn't work right. Right. Well, all of a sudden your brain starts working. You provide high quality nutrition to your brain. You provide adequate zinc and iron and creatine and carnosine and carnitine and anserine and all these things that you're lacking. You fix your gut because it's not being destroyed by all the starvation and malnutrition and garbage you're putting in there. Their brain starts working. And I kiddingly often will say that veganism is a mental health disorder because I see a lot of these people they're just unhinged. I'm just like, and then you start feeding them steak and they become more rational. It's just kind of like, so I don't want to be too flippant about this, but it is. It does fix the brain. A lot of people out there, we look at the stats today. It's like, what is it? Like 1 in every 4 women in America right now is on some sort of antidepressant or something like that, or some sort of, what percentage of our kids are on ADHD meds and antidepressants and all this crap. And a lot of it's nutrition related.
It's got to be a combination of our diet, our food, and our, what we're surrounded by. And, we're seeing now just mountains of data on the benefits of a ketogenic diet for numerous ailments, Alzheimer's, Parkinson's, every inflammatory. I can't think of anything that it hasn't helped, right? And that's actually how I came to meet you or to know about you. I got involved with a company that makes an exogenous ketone drink. We did this 10 years ago, and I'm not here to promote that, but we didn't know that ketosis was even good for you like we know now. 10 years ago when we started this project was started to provide soldiers with an energy source that wouldn't drop mental acuity, because you don't get a glucose spike if you're in ketosis.
I think Dom D'Agostino was doing some of that stuff.
And he was, I was going to ask you if you knew him. He was, we spun off from his group, and now he's got, I think, a competing product with ours. But I think God loves us, because since we've done this, there's just so much data that's just blowing my mind. And it was best said by Michael Smith, a guy that's on our board. He said, ketosis is not an alternate metabolic state. It's what we're probably supposed to be in. And carnivore provides that, right?
It does, or certainly can. I mean, it doesn't necessarily always have to be ketogenic, but it certainly can be and often is. And this is the thing, I want to go back to this effortless weight loss situation that my friend Amber Hearn likes to talk about. Ketones have been shown to help us to access energy in a way so that ketones themselves, I think, are been shown to, there's something called hormone sensitive lipase, which leads to lipolysis, right? And so ketones actually facilitate that. So when you're in a more ketogenic state, that's why a lot of people will talk about, I'm not hungry, because they're doing. So ketones do have a positive role. And the question I've always had is it what we have to do to get into ketosis? We're restricting carbohydrates. We're not eating every 15 minutes. Maybe we're exercising or things like that. Or is it the ketones themselves? And that's, I think there's a little of both, quite honestly. We know what they do have roles in the body. And as you mentioned, great study that, Georgia E., Chris Palmer, and some of these other folks were doing, showing that in patients with schizophrenia, major depressive disorder, bipolar disorder, go on a ketogenic diet, and they literally go into remission. This is exciting stuff. Yeah.
It's fantastic. Well, I don't think a lot of the public doesn't know that epileptic kids were put on ketogenic diets.
Yeah, it's back in the 1920s. Yeah,
yeah,
for sure,
80, 100 years ago. And I tell people that, they feed them oil, make them drink oil and stuff. But it gets rid of the seizures. It stops the seizures.
Yeah.
How hard to manage? Can you imagine?
Yeah.
Restricting a kid like that.
But carnivore is not hard to manage.
Well, it's simple in a way that, it's not hard to plan. My dietary planning is how hungry I do. I want 2 ribeye steaks or 1. That's as simple as it can be a lot of days. I don't really think about nutrition. I like to eat. And I used to be kind of a foodie guy, and, but you'd be constantly thinking about food. What's for lunch? What's for dinner? What restaurant am I going to go to? Blah, 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 blah. And it's not like I still derive pleasure from eating. A lot of people are like, oh my God, it's so boring. How could you live your life without the fact that you've got 75 restaurants you could go to, and there's so much food in the grocery store? But that really wasn't the reality of human existence for the vast majority of the time we're here. Even if you roll back the clock, maybe just 100 years ago, what do you think's in a grocery store? A little meat, some eggs, maybe some dairy products, maybe a few vegetables, maybe some fruit if you're lucky, some flour, some sugar, a few spices. That's it. That's what we lived on. And that's in a wealthy country. Now you go to some poor place and it's even more restricted than that. It's just modern refrigeration, modern transportation has allowed us to eat strawberries in January in friggin', Minnesota. That's not possible. So
look at the photographs, people on the beach in the 50s. There's no fat.
That was before. Well, that was before the Ozempic shortage kicked in, right? I kid around that.
Shawn, do you cheat? What do you do? Do you have a beer when you go out with some old friends, or a birthday cake at parties and stuff?
I'm not much of an alcohol guy. I'll have. My wife's from France, and so she's kind of a bad influence. Not really. She's pretty good. She's actually mostly carnivore, but I will have probably, I don't know, less than maybe probably in total 6 glasses of wine a year, something like that.
Really?
I just got back from Ecuador. We were with a couple other couples, and my son had a birthday. We were on a boat, on the Galapagos Islands, and the cooks, made a special cake. So I had a piece of cake. Like I said, I'm not religious about it, but it was like I did that more as a concession for him having his birthday.
Party.
I could care less if I had it or not, but I don't like build in cheat days. I don't look forward I can't wait till Friday so I can cheat. If it happens, it happens, but it doesn't happen very often. It's kind of like one of those things where I actually enjoy what I eat, even as restrictive as it might seem. And I feel good. And that's, to me, at this age, I'm almost 60, and I just like feeling good. I like to be able to play and run and jump and play basketball and sprint and do all those things that most people my age are unable to do, unfortunately, which I think is a tragedy. So, but again, this isn't a religion for me. This isn't like, like where a vegan might say, oh my God, I had an egg, therefore I'm no longer a vegan. I don't consider it that way, but I don't really, I realize there's a reality to it. And I think that for the vast majority, and this is what I see. I use this, in my clinical practice, in our company's clinical practice. We don't always put everybody on carnivore diet. Some patients we do, but not always. But the ones we do, we say, look, we're going to use it as a therapeutic tool. We're going to use it for 3 months, 6 months, however long it takes to resolve whatever issue we might be dealing with. And at that point, it probably makes sense to see where your limits are. Try to add this in, try to add that in, and see what happens. Some people are comfortable doing that. Some people are like, I'm good. I'm completely happy where I'm at. Leave me alone. I'll just keep eating meat for as long as I want to, and we're fine with that too. But I think that the reality is, of all the people that have done this diet, and at this point, like I said, there are many, many thousands, perhaps hundreds of thousands, 90% of them end up incorporating other food back in. And most of them will be mostly carnivorous. They will do what I think is appropriate. Your nutrition comes from meat, and then flavor enhancements and other crap, comes from the other stuff. And I think that's how we should do it. Meat should be the meat of the meal. That's why it's called meat. It's kind of a meat. There's people out there, for whatever reasons, health reasons, climate reasons, they think meat should be a condiment. You should have a big bowl of rice and beans and chickpeas and lentils and arugula and put a little skinny strip of chicken on there just so you don't starve to death, right? This is what we're being fed as a solution for the so-called climate crisis or whatever, humanity's salvation. This is the diet of India, basically, right? And you look at India. The health stats in India are miserable.
Miserable. They got highest coronary disease in the world.
Yeah, it's because they got a lot of people there. But their diabetes rates are the same as the U.S. And they eat literally. They have the smallest meat consumption in the world, next to Bangladesh. They eat 5 kilograms a year per capita. And about 28-30% of their population is vegetarian. But even the ones that eat meat, they eat a vanishingly small amount. And again, there's poverty and there's all these other socioeconomic factors that are in there. But it has not served them well to be, plant-based. If you look at the Olympic medals, their population of 1.4 billion people, and I think they've only ever in the history of India gotten like 10 Olympic medals since the 1920s. That's in China, same size country, and up until about the 90s, they had the same level of GDP. China has dwarfed them when it came to Olympic medals. They've got hundreds of them. So, it's just not the right thing. Plant-based is not the solution.
Yeah, that's a nice segue because you mentioned your clinics and what you do for your patients and your companies. I wanted to talk a little bit about, do you say it Revero? Is that how you pronounce that?
Yeah, it's Revero, Revero, Revero.com. And so we are basically a online digital health company. We got physicians licensed in all 50 states. Our goal, it's all digital, so we don't have any brick and mortar. Don't come to us for a broken bone or a cold. We can't fix that. But when it comes to chronic disease, we take care of metabolic diseases, diabetes, obesity, hypertension, metabolic syndrome, autoimmune diseases, most of them, not all of them, but most of them, inflammatory issues. And we just, we have protocols we've designed through interacting with thousands of patients to try to most efficiently, deal with their stuff. And a lot of it is nutrition. A lot of it is just day-to-day hand holding, and I think this is something that we have to realize, that when you're treating some of these people just need, they need a daily check-in. They need a lot of hands-on, face-to-face or a little contact time. And that's what we can provide. We have a whole team of coaches, and we've got all the patient education material we've put together. We've built apps for this. We've got all kinds of things. We send them devices so that we can get some feedback monitoring thing for them. And so that's what we've been doing. We started, we launched in late February, early May of this year. And we're just expanding. So we're authorized to practice in all 50. We opened, I think we're in like 7 or 8 states at this point. And we'll be adding every few weeks. We add a couple more states, as we find that we need to scale up higher. And so we've got something like 15,000 patients on the waiting list. So there's a demand there for sure.
That is fantastic.
Fun times.
How are you supporting your app? Do you have clinical nurses, or what what's the back office look like? So
So, obviously we have an engineering team to make sure that the app technically runs, but I mean, we have coaches, and we have, our physicians and our coaches have access to that. And so most of the day-to-day stuff the coach can handle. If there's something that needs to be elevated to the physician, then they'll get it. Or if it's a real true sort of maybe more emergent issue, then the physician will get it. And the physician has access to it. And he can access it all if he or she can access it all if they want to. But there's certain things that they'll get flagged on. So we know that, we're doing, we're not missing anything, because that's, as it's harder to practice medicine remotely. It's not impossible, but it's harder. And you have to limit. I remember when I was in my orthopedic residency, I did it at University of Texas, and we would work with the TDC, the Texas Department of Corrections, 3 months out of every year. We'd work on prisoners, and we would have to sometimes do remote orthopedic clinic through a freaking video camera. You can try to imagine doing orthopedics through a video camera.
Right.
Like, we're telling the nurse, the prison nurse, hey, make the guy duck walk in the room and ask if he has pain. It's like, move it's like impossible. I mean, we had so many F-ups. I mean, we bring, well, maybe his ACL is blown. Let's bring him in, schedule him for surgery. They get there, we get him in the holding room for the OR. Like, shit, your ACL is not torn. Oh, well, cancel the surgery, or we do something else. I mean, it was kind of a joke, but a lot of this stuff, like a lot of the chronic, the diabetes, the obesity, all those things are pretty easy to manage remotely, quite honestly.
When we're talking about your clinic, is kind of brainstorming here, but there's another company that Jeff and I are involved with, called Sequence. And what Sequence is doing, you got all these biomarkers. You're probably familiar with every single one of them. There's thousands of them that have been validated for various different diseases and processes. The guy that started it with his son, who's got a PhD in, what is Noah's degree in it? Is it biochem? Anyway, they've got some.
And biochem, I believe.
Yes, they've got some software, AI software. You take a drop of blood, maybe spit. I can't remember. I think it's blood, but it'll do like 2,000 biomarkers in like 4 hours. And most of these biomarkers, one biomarker takes, a few hours to run, but they've got a platform. So I don't know, maybe it makes sense as you get going here. And once that gets ramped up, maybe y'all make the introduction, because I can see where your Revere clinics, that would be a value add for your patients.
Yeah, I mean, it depends if it's actionable. Are you willing to make the change that would be necessary based upon the results of the test? If the answer is no, or the intervention doesn't make sense, then why order the test in many ways?
Right.
I kind of look at it through that lens, and trying to be, like I said, our healthcare system is so bloated, and it's like, I remember when I was on internal medicine rotating as a medical student. Every day you get a slew of labs on these patients, and every day is the same damn thing. Like, why do we get this?
Yeah, they get anemic. We draw so many labs. The old lady gets anemic, right? You remember that?
Yeah, we watched the hemoglobin drop from 9 to 8 to 7 to 6, and you're like,
why is she getting anemic? Because
maybe she's got to bleed. Maybe she's got to bleed. No, because you're taking a liter of blood from her every 3 days. Yeah.
Well, so I want to make sure everybody knows where they can find you. You're on X, Dr. Shawn Baker. On X, my handle is SBakerMD. I think it's Dr. Shawn Baker, or what is it, Shawn Baker MD or something like that on X. I'm on X. I'm on Instagram, Shawn Baker 1967, SHAWNBAKER 1967, and then Shawn Baker MD, YouTube, and what is the other one? Facebook, and then TikTok. All those. And I got your book on. I either got it on Amazon or Kindle. I can't remember, but it's digitally available. Right. Yeah. Yeah. Right. Digitally. It's now audio too. It's kind of funny. I mean, my book, I published that book in 2019, and it's done well. It sold a lot of copies, and they put it on audio like 6 months ago. I was like, well, why did you guys wait so long to put it on audio as a publisher? Whose voice is it? Is it? No, it's not right. It's not my voice. It's some Canadian actor. It's got a better voice than me. Does a pretty good job, but I can't remember the guy's name. But yeah, it's an audio book. It's on, it's on Amazon. That's where a lot of people get them. But yeah, I wrote it 5 years ago, but I don't know that I would change really anything from the. Now, yes, there's been more studies I could have incorporated now that have been done since that time, but the advice is still solid. I mean, what a human needs to eat hasn't changed in the last 5 years. It hasn't changed in the last 50,000 years, to be honest. I mean, so it's unlikely to change. It's just, it gives you sort of the justification and walks you through the rationale and how to implement it. And I don't think that'll ever change unless
we got to develop some sort of alien food or something like that. Maybe that'll happen.
Yeah. Well, we've covered a lot. I want to be respectful of your time. Was there any other topic you felt like we needed to cover, Jeff or Shawn?
Well, I mean, not a topic. I mean, the Make America Healthy Again sort of movement that has now evolved, and with RFK and all this stuff and Trump's election. I mean, I got to tell people that I'm, certainly I'm supportive of that discussion, and hopefully we can have some meaningful changes. I'm a little bit concerned that, where it'll get bogged down and how many legal battles we'll have to go through, and whatever the dream is, the reality is probably way down here. But I think, if we're going to think about that, it really falls upon Americans to make America healthy again. It's not some politician. So we've got to collectively come together as a population and say, look, we're not going to support this stuff anymore. If we know that the RJ Reynolds, Nabisco, people are poisoning us, just stop giving them damn money. That's the only way it's going to change, in my view. I mean, it has to be. And if you're tired of being, stuck in the system, then stop paying for the system, and I mean that by, every time you give a nickel to the people that sell you garbage food, that's a nickel they got to have more control over you. So, I mean, we all got to do it. It starts at home, starts with you, starts with your family. If you got kids, your kids are going to do what they see you do. You can tell them don't eat crap with them, but if at the same time they see you eating this garbage, you got to be the example. You got to be the example for your kids. And I think that's important.
I couldn't agree more. And just one couple final other points. I'd love to see you involved with RFK Jr. and that whole.
Yeah. I mean, I was invited out to Trump's place at Mar-a-Lago back in February to sit down with RFK, Trump, and a few others in that group. And unfortunately that Hurricane Helene came through that exact same day. So they canceled it. So I'm on the radar. So we'll see. I've got, like I said, I suspect I'll have at least some, whether consultancy role or at least I know a lot of the people in that movement.
That's fantastic. And one final thing, I mean, I could talk to you all day, but just be respectful of your time. It doesn't cost more to do this. Like right now, we were on a trip, so we ate junk food this weekend. It's $10.29 for a combo meal at McDonald's. Okay, depending on your location. Also, depending on your location, what does it cost for a pound of meat?
Yeah, it's usually about $3, $4, $5, depending on.
Yeah, and maybe you want to do a ribeye and it's 12, right? And you're going to eat 2 ribeyes. If you're going to eat McDonald's for 3 meals a day, and you're probably going to have some snacks, it's going to cost you more than $25. I got news. So the people that say it costs too much to do this, to eat right, what does it cost you when you feel bad? What does it cost you for the associated healthcare and the cost of that?
Yeah, I mean, it cost is in this country for sure. In the U.S., cost is not a real issue, I mean, for most people, because most people that I've talked to that have done this, that don't feel like they have to eat, USDA prime ribeye steak every day. They're willing to do ground beef and things like that. Yeah. Most of them say, look, I actually spend a lot less money on groceries than I used to, because you just eat less. Yeah. I mean, you think about, we didn't get into this so much, but when you're eating all these fruits and vegetables, and half of them, organic fruits and vegetables, and they go rotten in your fridge, and all the strawberries get mold, and you throw half of it out. Right. And not to mention the fact that you're not absorbing a lot of the nutrition anyway. A lot of it's going down the toilet. So it's actually, because you're more satiated, you actually eat less. People eat a lot less on this diet than they would on these other diets. So you actually save money for sure for most people.
So it is more up to us, the consumer, than what the people that are selling us, I would think. I mean, I had an example recently. I try not to go through drive-thrus, but I left the house that morning without a plan, went through Wendy's, 11 o'clock, 10:30, whatever it was, and got like a sausage biscuit. I took one bite and I could taste the sugar crystals. I mean, it was just laden with sugar. Yeah. And I couldn't eat it. And I just thought, but that's how it's an addiction thing. That's what it's doing to people.
Yeah. I mean, this processed food stuff. I mean, I had a gal, 60 something year old woman that had worked for like McCormick or one of these big flavor companies, like food industry. She was a food chemist. And she said, look, I spent the last 25, 30 years of my life making food as addictive as possible. That was literally my job. And she had horrible regret about doing that. She wanted to come work for our company. I said, look, I'll work for free for you guys, because I'm a very accomplished, got a PhD, but she felt guilty about this because they've engineered this stuff. But I will say something about like fast food places, man. When I'm on the road, I'll go to Wendy's and I'll order burger patty. I'll say, hey, give me six year burger patties, throw a piece of bacon on there, and I'm good. And that's actually legitimately reasonable. There's nothing wrong with that. I mean, there's nothing wrong with doing that from time to time. Well, and some people, that are impoverished, that might be the answer for them. Go to freaking McDonald's every day and get
just eat the burger patty.
Yeah, just do nothing else.
Sugar is poison, and I'm convinced that, and I hope in our lifetime it comes with a warning label like tobacco does. Mm. Now, Dom D'Agostino, hope I'm pronouncing his name correctly. I listened to him, a lot of stuff. They took, it was glial cancer cells. They put them in beta hydroxybutyrate, and they put them in a traditional agar, which is sugar. The beta hydroxybutyrate, which is a ketone, kills the cancer cells. And there's all these different animal studies and anecdotal studies in patients like sugar feeds cancer, sugar feeds inflammation, ketones kill all the bad stuff, right?
Well, I mean, there's certainly some evidence. I mean, Tom Seyfried is a good one about that, talking about, if we can reduce insulin, or if we can reduce glucose rather, then we can see a lot of the cancer cells like that as fuel. They also use glutamate, or at least some of them do. So you have to deal with it from both ends. But yeah, I mean, certainly, sugar, particularly excessive sugar, is a real problem, and it's a real problem in the diet. And I go back to the data. You look at the data from 1800, where the average American would consume around something like 5 pounds of sugar a year, which sounds a lot, but today we consume 100, 120, 150 pounds a year. So in essence, the average like 7 or 8 year old child has consumed more sugar than someone at that time would have consumed over their entire lifetime. And so we clearly consume too much of it, for sure.
That's great.
The reason I got into this in the first place is because when I was doing total knees, and, the community was saying we're operating on too many fat people. And, the fat people have higher rates of blood clots and infection rates and wound complications, and they don't rehab as well. So we were like, as a community, like all of us stood together and said, hey, we're going to BMI over 35, no surgery for you. Unless you go through some sort of weight loss program. But they didn't give us any sort of like, this is how you do it. It was kind of left to our own devices. So I would put my patients on ketogenic diets, or try to, only 20% would actually do it. Mm-hmm. But the thing that really blew me away was I had people with, legit shitty, bone-on-bone arthritis that I had on the OR schedule. And they come back to me, 2 weeks later and said, you know what, Doc, man, he doesn't hurt anymore. That was the first thing that kind of raised the sort of the hair on the back of my head, saying, wait a minute, what's going on here? So that was kind of how I got into this. And so I found that, believe it or not, a lot of these conditions, and even if you end up going through surgery, like there's some people I'd still take to the OR, but they would recover better. I mean, they'd be sitting there post-op day one after a total knee, like, I don't have much pain. And, again, we've gotten better with the regional catheters and the PCAs blocks and all that stuff, and blocks and all that stuff. But even still, it was noticeably better. They were just not as inflamed. And again, that predicts better wound healing. And so, and I mean, when you look in the literature, like for instance, if you look at the literature for like trauma patients, like burns and things like that, but also for like big operations, it's recommended you increase the protein intake by about 10 to 15% for that month afterwards. And so again, that's just going to put things in your fever. Hey, go eat a steak every day, dude. Just give them permission to eat a steak every day for the next month after they had their surgery. And you probably will see your outcomes better. I mean, this is something that I think it'd be nice to do a little fun little, intervention trial and see how that does. You can get historical numbers versus this sort of intervention.
And we need the American Beef Association to fund it.
No kidding.
Well, I'm trying. Believe me, I talked to those guys. The NCBA, I've been on those guys' case for years now. And last time I was on Rogan, I bitched about the fact that they weren't funding these studies.
Yeah,
I said, look,
they need
why the hell aren't you guys funding this stuff? And that got their attention. And so I've had every guy from the head of that organization to all the vice presidents calling me, contacting me. How can we help you? What can we do? So I'm working with state of South Dakota Cattlemen's Funds Company, the National Cattlemen's Beef Association, the Oklahoma guys, to get some of these studies rolling. But it's going to start with like diabetes and stuff like that. Carpal tunnel syndrome is not high on the priority list, unfortunately, but it does make a difference. You can try it in your own practice just to see.
Yeah.
The inflammatory component. I had a couple small random questions that just didn't really fit in during the podcast, but if your patients, for instance, if they're going to walk back to start having some vegetables or whatever, are there one or two that are on a good list?
I mean, the lower glycemic things tend to be better tolerated for most people. So like, berries rather than grapes or something like that, when it comes to vegetables, it really depends on some people. The fiber is just a real issue. Believe it or not, we're told we should eat all this fiber, but fiber for a lot of us, I mean, we're just not physiologically adapted to digest much fiber. I mean, we do comparative anatomy. Like humans have about 14% of our gut can ferment fiber on a sort of a total anatomic basis. You contrast that to like a chimpanzee where it's about 45% and a gorilla, which is like 60%. So our fermentation capacity is quite small. And in fact, our fermentation capacity, believe it or not, is exactly the same. I may be a lot. I think it's like 17%, but cats and dogs are about 15%. So our diet probably should resemble more of like a cat or a dog. And dogs, in theory, dogs were sort of co-evolved. We domesticated them from wolves as they coexisted with us because they helped us to hunt, and they would like hang out with us and eat our scraps. And a dog's diet by design, it should be, obviously mostly meat. So I think it depends on the patient's, underlying condition. For most people, if they've got like bona fide gut issues, if they've got Crohn's or ulcerative colitis or something like that, they're going to have to go very slow on that. If it's just like they're too damn fat or they got a little bit of hypertension or diabetes or something like that, then most of them tend to do pretty well. You can bring back in some things like, some people would say things like squashes and zucchinis and things like that would be a little less problem. Some people would advocate for fermented vegetables, so kimchis and sauerkrauts and things like that, because what's happening is because it's pre-fermented, there's less of that going on in our own gut, and that fermentation by definition creates all this gas, which leads to distension, discomfort, and pain, and perhaps compromised permeability type of thing. So that's kind of the deal on that. I tell people, if they're going to do the diet, if they're going to do an elimination diet, they phase something out, they fix their lupus or something like that, they get better, then spend a period of time, a couple months trying, sample, small amount of this. I'm gonna have a few strawberries, see what it does to me. Give it 2 or 3 days, because that's usually how long some of these sort of issues can last, and then repeat it multiple times. If you're issue free, then that's probably on your safe list. Like our company has like these green, you should be able to tolerate this. Yellow is kind of like maybe, and reds are like, the ultra processed carbs. You never need to eat that crap. When you're taking symptoms, if somebody's got a headache, somebody has chest pain, God forbid, if they have difficulty breathing or pain with breathing, all of that is a red flag for, hey, there's a problem here. But if we have gut pain, oh, it's bloating, it's uncomfortable, we just say, oh, that's normal digestion. I don't think that's right. I honestly don't think, why would we be designed to be in discomfort or pain? It just does not make sense from a very basic level. And so my thought about that is either the gut is broken or the food is wrong. I mean, those are one of the two conditions is there. And sometimes it's both, obviously. But so I think whatever you eat, it should be like my digestion. When I eat a big old steak, I mean, I'm so adapted, I don't even know I'm digesting anything. It's like there's nothing in my gut. I don't feel it. There's no sense of digestion going on. It's silent. It's like going in from a really high-end Mercedes to a beat up old, Chevy Malibu or something like that, where all the noise is there. It's like, whoa, it's all smooth now. Yeah, it's like it's a big difference.
Awesome. Well, man, I could talk to you all day. I could listen to what you're saying.
I can talk all day. I got to get a workout in, man. So I would
this has been great. I mean, this is right in my wheelhouse. I'm licensed in 4 states, and I love this stuff. If you need some help with this, Revere, that's
the thing, and what a most of the physicians that work for us do it part-time, because it's, and what they do, like I got a buddy of mine, he was an investor in our company. He's an orthopod down in Monroe, Louisiana. And he opened his own like side clinic for doing this type of stuff. Yeah. Like he calls himself the fat doctor or something like that. But I remember I was there with him, and he was, I think that he got an OR day, and they canceled some of his cases for some reason. Normally as an orthopedic surgeon, you're pissed, right? You're like,
yeah.
Well, it's probably anesthesia's fault.
Well, probably, right. But whatever it was. But he was like, awesome, man. I'm gonna go to my other clinic and have fun. He was having more fun doing this lifestyle transformation stuff than he was doing what he was trained to do, which I thought was kind of cool because it is fun when you can take people, you get somebody pat you on to give you an attaboy. Yeah, my carpal tunnel's gone, or, whatever, my trigger finger's fixed. That makes you feel good.
Yeah.
But when you get somebody, you're like, you know what? I was suicidally depressed and I was,
right.
And now I got a normal life. That's so much more powerful. So I get that all the time now, which is really fun. It's a fun way to practice medicine. So we have most of the people that work for us are primary care folks, but it doesn't need to be. We have rheumatologists that apply to us, and I'm happy to have them because we do a lot of autoimmune stuff. But it's not hard. This isn't hard. So this isn't rocket science stuff. As orthopods, we're all smart dudes. There is, and we have all the training. We have we have physician modules where you train us. So a lot of the guys will do it like 8 hours a week or something. 1 day a week, they'll just do this. So like, if you get to a point where you're like, I can step back from my full-time practice and I want to have fun for a couple hours a week or a couple days a month, that's a viable option. And I think that's probably, for most people, that's a good way to do it. Cause you feel like you can, you've got the safety net of doing what you've always done. You can make good money on that, but at the same time, then you can have fun, which is why you might've went into medicine in the first place. I think we need to fix healthcare. As physicians, we got to stand up and stop friggin' letting these damn
we agree
dictate to us and take it back.
100%.
Yeah. We're all good guys, right? That's the end of the day.
Yeah.
Jeff Brown, you may not know this, but our funding platform, Merge Medical, we have a sister company that's building software for us. They're also their main goal is to merge traditional finance with the crypto world. And making tools for banks to be able to custody.
Yeah, I think it's going to happen. Particularly if, because Trump is pretty bullish on Bitcoin, and if he gets in there, and particularly if he puts it part of our strategic reserve, then that's going to be, that's going to change. It's going to skyrocket in value for one, which will be kind of nice for those people to have it. Yeah, I'm speaking at the Bitcoin conference. I spoke at the one in Nashville. It was kind of funny. The big Bitcoin conference was in National this year, the biggest one, or whatever, 25,000 attendees. And Trump spoke.
Yes.
And I was supposed to speak on Saturday. So I'd kind of made all this arrangements and schedule. And they said, hey, we got to bump you because Trump is speaking. Can you speak on Friday? And I was like, no, I can't, because I couldn't change the plane ticket. So I went in there, I watched Trump speak, and I had already committed to a bunch of other things. I did a bunch of podcasts where there, and I met with people, but I'm speaking again in Vegas this year. I'm assuming Trump doesn't bump me again, but I thought it was kind of funny when I got bumped by Trump. But anyway,
that is great.
Yeah, good stuff.
Awesome.
Yes, sir. Well, Shawn, we've been going for about an hour and 20 minutes. I want to close it out. A little tongue in cheek. You're the most well-read, educated, smart orthopedic surgeon I know. That's for sure. And I can tell you've done your research. This has been a really fantastic podcast for us. We really want to thank you for joining us. We're going to talk a little bit offline, and then I'm going to let you go. But everybody, thanks. Dr. Jeff Brown, Dr. Jeff Cole, and the Carnivore Diet author, Dr. Shawn Baker. Thank you so much.
All right. Thanks, guys. Appreciate it.
Man, that was awesome.